Hi everyone, my name is Joel,
Hi everybody, my name is Humberto.
and today we are going to be presenting on extraocular muscles. At the center of the slide, you'll find an eyeball lifting weights. Prior to beginning, I believe that learning the anatomical terms of location is important. Superior means above, inferior is below, medial is central, and lateral is on the outside. The superior rectus is located above the eyeball, and it allows the eyeball to turn upward. So when I am looking at the ceiling, that is the muscle that is being initiated. The inferior rectus is a muscle that is beneath the eyeball. And when I am looking down, that is the muscle that is being activated. The medial rectus is a muscle attached to the side of the eyeball nearest to the nose. So when I am looking to the right, the muscle that is looking, or the eyeball that is looking to the right on my left side is being utilized or the medial rectus of the muscle of the eye is being utilized. And then for the lateral rectus, it's opposite in how the muscle is located on the outside near the temple. And when I am looking to the left, the muscle on my right eyeball is being initiated. The superior oblique is a little bit more complicated in how it comes from the back of the orbit, or also the eye socket, traveling through the trochlea ligament near the nose, and then it attaches to the top of the eyeball. So you can see that it is this muscle right here, and it travels through the trochlea ligament and ends on the eyeball. It rotates the eye inward and also moves the eye downward. So it has multiple functions. The inferior oblique arises in the front of the orbit near the nose, and then it travels outward and backward in the orbit before attaching to the bottom part of the eyeball. It rotates the eye outward and then moves the eye upward. So you can see that muscle is located right here on this image. The next slide are the muscles of the eyelids. There are two of them, and the first one is the levator palpebrae superioris. This muscle is located in the orbit that elevates and retracts the upper eyelid. It also maintains the upper eyelid position. So when I am blinking rapidly, that is a muscle that is being utilized. The orbicularis oculi is a muscle that encircles the eyelid and closes the eye. So it's located right here, and when I am sleeping, that is a muscle that is mostly in use. Two eye conditions associated with extraocular muscles are strabismus and Graves' disease. The image on this slide is of an individual with strabismus. Strabismus is a condition in which both eyes do not look at the same place at the same time. Therefore, they are misaligned, and it usually occurs in people who have poor eye condition, poor eye muscle control, or are farsighted and may be caused by trauma or infections. The three forms of strabismus are esotropia, which is when the eyes are crossed, exotropia, when the eyes diverge, and hypertropia, when they are vertically misaligned. The treatment for strabismus may include eyeglasses, prisms, vision therapy, or eye muscle surgery. Graves' disease is an autoimmune condition in which the thyroid gland produces an excessive amount of thyroid hormone. As a result, the thyroid gland enlarges, and therefore it affects the eye muscles and connective tissues within the eye socket. Next, Humberto will be covering the lesson for teaching. Take it away, Humberto.
Okay, so hi everybody. We're gonna talk about uh, a lesson plan, a small lesson plan that we can do for teaching a student that has uh, the eye conditions mentioned in the ocular muscles, like strabismus, or any other student that in general may want to learn more about their ocular muscles, the blind, visually impaired students. The lesson can be presented in three kind of differentiated formats with different types of ways they can do it. Number one, you can present them with a high contrast diagram of the eyes, the ocular muscles, the different types of muscles that they have, and they could label them, color them, and they can demonstrate the muscles to the teacher, and or they can work with the teacher as well to help them label them or color them, whatever is easier for the student. They could be presented with a tactile 3D model of it, like a puzzle. The puzzle, they can do the same thing with the aid of a teacher or without. They can just label them or put this together. And once they're finished, they can show the complete project to the teacher. Number three, they could just do the things like one or two, except they instead of providing a complete project, they could just label their stuff and take notes and show the notes to the teacher so they can give feedback and the teacher can see where they're at and how they're learning the eye parts. Okay, next slide, please. We're going to talk about some accommodations for students that may have strabismus or any eye condition related to the ocular muscles. That is, high contrast, preferential seating, probably on the front of the seat of the classroom, given a slant board, which is a device that can provide support for desk of a student with low vision, as well as enlargement of materials and different types of low vision support magnification as well. Next slide, please. We're going to talk about some accommodations for students with conditions related to the ocular muscles. Strategies. Some strategies related to this. Reduce the clutter. We also do like low contrast. Make sure that the contrast is clear and things are simple to do, simple to see, so the student does not have eye strain or vision problems. Things are less clutter and more focusable. And this accommodations strategies are for students any student, all students, not just these students with low vision. In the next slide is our references. Thank you so much for listening or watching our presentation. Please be on the lookout for our resources page and handouts that we may provide. Thank you so much and have an awesome day.